virtually today from various parts of the academic, research, and scientific communities. We are absolutely delighted to welcome you all to this online webinar organized by the ANRF PAIR project team and the School of Nanoscience and Nanotechnology from the Mahatma Gandhi University. Today, we gather to explore a domain where advanced nanotechnology meets critical biomedical solutions, and our focus revolves around a highly promising, high-impact research initiative under the prestigious ANRF PAIR project titled Intelligent Transdermal Patches Based on Modified Bacterial Nanocellulose for Diabetic Wound Management. Before we begin, a few reminders. Please ensure that your microphones remains muted during the presentations to avoid background disruptions. To guide us through the nuances of this groundbreaking research, we have the privilege of hearing directly from the vision behind this work. It is my utmost honor to introduce our esteemed speaker for the day, Dr. Sreekala M S, the project investigator of this ANRF PAIR project from the Department of Nanoscience and Nanotechnology. Dr. Sreekala is a well-known academician, and she's also the Joint Director of the School of Nanoscience and Nanotechnology. Is widely recognized for her extensive contributions to polymer nanocomposites, biomaterials, and green nanotechnology. Her leadership on this project marks a vital step forward in translating laboratory nanoscience into tangible healthcare advancements. On behalf of the ANRF PAIR team and the School of Nanoscience and Nanotechnology, I warmly invite Dr. Sreekala M S to take over the virtual screen and enlighten us. Ma'am, please.
Okay, thank you. Thank you very much, Gladys. Very distinguished delegates from the PAIR team and also outside the PAIR team gathered virtually here. A very good morning to all. And I'm very happy to share our project perspectives of this PAIR project today. And a warm welcome to all to this seminar. And I am sharing the screen now. Just a moment. Is the screen visible to you and audible?
So you're audible. Okay. Now it is visible.
Visible, yeah? It's okay?
Yes, ma'am. It is okay.
Okay. And today, myself, as Gladys introduced, I am Dr. Sreekala M S from School of Nanoscience and Nanotechnology. Together with me, the project associate along with this project is Gladys Maria Reggie. And our collaborating team with the University of Hyderabad is Dr. K. Muralidharan from School of Chemistry. The title of the project is Intelligent Transdermal Patches based on modified bacterial nanocellulose for diabetic wound management. And presently there are projected global cases, that is around 700 million cases are there. And in India, the current diabetic adults are 77 million. And in 1 in 5 diabetic wound is coming into a risk stage. As we know, diabetes mellitus is a chronic metabolic disorder characterized by persistent hyperglycemia, chronic non-healing wound development risk, which is the peculiarly sluggish healing, infections and worse amputations are there. And in worldwide, every 10 seconds, one leg is amputated due to diabetes. And hence, this kind of research work receives utmost importance actually. The pathophysiology of the impaired healing of a diabetic wound is because of the cellular impairment, that is the impairment of fibroblast migration and proliferation, reduced collagen synthesis in the wound area, delayed re-epithelialization process. And also it contributes to the neuropathical reasons, that is diminished sensor perception, progressive tissue damage, etc., and also vascular complications in the wound, poor peripheral circulation, impaired oxygen and nutrient delivery to wound sites, and impaired angiogenesis. And the explored solutions present day is surgical debridement and bioengineered solutions, which faces limitations in cost, immune rejection risk, rapid degradation, and insufficient angiogenesis. Need for an advanced wound care technology, therefore, it is needed for biocompatible, efficient, and cost-effective way. And the present research objectives are the patch development, that is the first objective. Patch development from bacterial nanocellulose, which is produced from agro waste, and incorporating phytochemicals and other ingredients to improve wound healing. And the patch fabrication is the first stage. Then it's with in vitro assessment, assessing the biocompatibility, cell proliferation, and angiogenic potential in cell culture models. And if we succeed in the in vitro studies, we can go for in vivo validation, compare wound healing outcomes in normal versus diabetic mice models for clinical efficacy. And these are the main objectives of the present project. And coming to the cellulosic materials. Cellulose is the oldest biopolymer, which is the most abundant polymer, natural polymer on earth, because all plant cells contain cellulose. It is a linear homopolymer of beta 1,4 linked glucose. And cotton and wood, all wood materials, the plant materials are the source of cellulose, but there are rich sources of cellulose, of course, in the nature. And we are getting cellulose nanofiber, cellulose nanocrystals, and different types of cellulose are cellulose nanofiber, cellulose nanocrystals, and bacterial nanocellulose. And this picture shows cellulose, plant cellulose. This we can, from the plant sources, we can extract cellulose nanofibers, and we can extract cellulose nanocrystals also. That is usually by using chemical media. And this is the structure of the chemical structure of the cellulose. This is the beta 1,4 linked glucose units we can see. And but in the present project, we are not using the plant cellulose, we are using the bacterial cellulose. And what is the advantages about the bacterial cellulose? That is explained here. Bacterial nanocellulose is a natural cellulosic biopolymer synthesized extracellularly by bacterial strains through the process of fermentation. This is a homopolymer of beta 1,4 linked glucose. The resulting 3D network of nano-sized fibers is 20 to 100 nanometer, which closely replicates the body's natural collagen extracellular matrix structure. And this picture shows a bacterial nanocellulose synthesized in our laboratory. And these the main features of this bacterial nanocellulose include high water holding capacity, excellent mechanical strength, high crystallinity, biocompatibility, biodegradability, and flexible and skin conforming properties of this bacterial nanocellulose. There are various merits. Sustainable production. It is synthesized from the agricultural waste, molasses and glycerol, promoting a circular economy. Then it can be molded, in situ moldability. Using a suitable fermentation vessel, we can mold it into specific shapes. And it is biocompatible, more biocompatible than plant cellulose for internal medical implants and skin contact applications. Then it exhibits superior strength because of the nanofibrillar network provides structural reinforcement comparable to industrial synthetic fibers. It is in between 100, below 100 nanometer, and we are getting very fine fibers within that network. Then ease in production. Extracting plant cellulose involve various long and various procedures, chemical procedures, and we have to purify for the plant cellulose from lignin, pectin, and other impurities. But in the case of bacterial nanocellulose, we can say it is as a bottom-up process. It requires no intensive chemical purification needed. It is synthesized by the bacteria in the purest form. And that is the advantage of bacterial cellulose. And this is the comparison between the plant cellulose and bacterial cellulose. It is extremely highly pure cellulose. It is a nano-sized fibrils. We are directly getting the nano-sized fiber. But in the case of plant cellulose, we have to convert it to nano size by suitable chemical treatment or mechanical forces. Then it is very high crystalline, highly crystalline up to 90%. Therefore, we can imagine the property of the system. And tensile strength is exceptionally high. Young's modulus is there. And the biocompatibility is excellent, which is suitable for medical grade applications. And this is the production journey. Actually, the first step is inoculation. For the bacterial nanocellulose, prepare a bacterial culture in specialized growth media. The second step is the fermentation, 6 to 10 days of fermentation, static or dynamic ways we can follow. Then bacterial secrete cellulose. And then it has to be purified, just purification alkaline treatment to remove bacterial cells and residual media. And then washing and sterilization to produce the final bacterial nanocellulose. A very simple way we can produce. And this is the schematic or the pictorial representation of this synthesis of bacterial nanocellulose. First, we ferment in the media and isolate the microbial colony, and then the cellulose pellicle formed at the liquid air interface during incubation. And here is the pellicle formation, that's the bacterial nanocellulose formation. And the next step is the purification with just simply using alkali, no severe chemicals needed for this purification process. And finally, the neutralization and washed pellicle is neutralized and ready for use. And we can dry it or we can use it in different forms. And bacterial nanocellulose, in the present project, we are aiming to utilize this bacterial nanocellulose in wound healing applications. And you can see the scanning electron micrograph of the nanocellulose, bacterial nanocellulose prepared. And this is the diameter is under 100 nanometer. And we are getting a very nice topography and very nice distribution of the fiber. Then this nanoscale topography provides an enormous surface area to volume ratio, directly facilitating nutrient exchange and drug loading, promoting cell proliferation and tissue regeneration. The interconnected nanopores are perfectly sized to exclude external bacterial contaminants while remaining permeable to respiratory gases like oxygen. And there are several advantages for this structure, and it maintains moist environment. It's very important that it can hold up to 100 times its dry weight in water and donates moisture to dry tissues beds while absorbing excess exudates. Because when it applies to the wetty wound area, it can absorb the exudates. The biocompatibility, it is highly pure, non-toxic and hypoallergenic, and it integrates seamlessly into chronic wounds without triggering immune reactions. Then tensile strength, it's excellent mechanical integrity even when it is hydrated. And hence it is easy to apply, mold and remove without tearing the delicate tissue, which is very important in the wound patches actually. And the active functionalization of bacterial nanocellulose, it is an antibacterial substance. We can incorporate antibacterial substances safely into this system. Metallic silver or zinc oxide nanoparticles. Then chitosan and other polymers. We can blend chitosan or other polymers. For example, chitosan creates a strong antioxidant properties that neutralize dangerous reactive oxygen species in chronic wounds. Therefore, modification or we can tailor the patches actually. Then sustained drug delivery is possible because the membrane is porous and it can encapsulate and sustains the release of small molecules, therapeutics, proteins, and localized antibiotics. Then growth factor delivery, that's also possible. Recombinant growth factors like this vascular endothelial growth factor or fibroblast growth factor can be integrated to directly enhance vascularization and rapid re-epithelialization. And hence this we can functionalize the bacterial nanocellulose as we need. depending upon the application. Then the main challenges occurring now regarding the bacterial nanocellulose production is its scale-up cost actually. The high capital and operational expenditure associated with the specialized bioreactors and high purity media requirements. Then low yielding strain, that's another challenge we are facing now. Biological limitations of wild type bacteria that produce insufficient cellulose mass for commercial viability. Then functional composite development, the complex chemical engineering required to integrate bioactive agents without compromising structural integrity. Then sustainable industrial production, the challenge of transitioning from lab scale eco-friendly and high volume manufacturing lines. These challenges we are addressing, and for example, this alternate fermentation media for cost reduction we are looking for. The Hestring and Schramm media is the synthetic media commonly used for commercial application now, but it is not feasible for commercial production because of its high cost. Therefore, we are looking for an alternative culture media that is based on agro-based, that is studying. And these are the products we made. This is the bacterial nanocellulose production we did in our laboratory. And we got a very good yield. Wet BNC yield is 421 gram per liter. Moisture content is 95%. The dry yield is 21 gram per liter. And early fermentation film is seen as flexible and skin conforming. Prolonged fermentation resulted in the formation of thick opaque pellicle. Therefore, we can control the experimental conditions and we can produce the bacterial nanocellulose as we need. And the expected outcome of this study, that is, we are developing a novel intelligent transdermal green aerogel patch based on modified bacterial nanocellulose. The multifunctional wound health patch that will be biocompatible, sustained delivery, drug delivery possible, antimicrobial action will be possible, real-time wound condition monitoring, and minimal invasive and painless application. And it should be sustainable, cost-effective innovation based on biodegradable material, based on agro-waste derived, then reduced overall expense because it is completely on the sustainable materials. And we are looking for potential patents and high impact publications and products prototypes from these studies. And there are various other applications also for bacterial nanocellulose. We can find a lot of applications because it is a novel material with many functionalization possibilities in the purification, water treatment, environmental applications, packaging industry, cosmetics and personal care, and other industrial areas like flexible electronics, sustainable textiles, high performance acoustic diaphragms, 3D printing inks, etc. Therefore, it's a project, actually, it is a base material with a novel, versatile applications. And in conclusion, this multifunctional intelligent platform integrates angiogenic stimulation, antimicrobial protection, and real-time wound healing monitoring with a single sustainable scaffold, enabling cost-effective and patient-friendly chronic wound management accessible to all socioeconomic strata. Such a system can be particularly valuable in war zones and emergency medical care. It can benefit people who cannot frequently visit hospitals for dressing changes or follow-up checkups. In remote and rural communities with limited access to healthcare facilities, may find applications in home-based care for elderly and diabetic, long-term management of chronic wounds, pure surgical wound, post-surgical wound monitoring, then disaster relief settings, because it can be used easily by person itself, by the patient itself. They can manage the change and removal of this wound patches actually. This sustainable innovation bridges rural and urban technology healthcare gaps while reducing the clinical burden. By utilizing agro-based derived bacterial cellulose, the technology addresses both economic and environmental concerns critical to India's diabetic population management. with that, I conclude and I express my sincere thanks to Gladys Maria Raji. She is doing all these laboratory works and analysis, all these things. And I express my sincere thanks to all the pair team and ANRF for the funding. Thank you. Thank you.
Thank you so much, ma'am. Thank you for the wonderful talk. So we'll now open the session for discussion. So please feel free to raise your hands and unmute and ask for questions.
Yeah. Hello.
Okay, ma'am. Please.
Yeah.
Madam?
Yes.
Okay, thank you for the nice presentation, ma'am. The title of your talk is Intelligent Scaffolds. And in your presentation, you have mentioned only about the bacterial nanocellulose preparation. Whether you were successful in the patch synthesis, and what do you mean by intelligent patches?
Yeah, this is a intelligent path. Patches means because it is a smart material, we can functionalize it because with a single one we can incorporate antioxidant or bactericidal elements into that, and that is why it is called. And we are a dopamine reinforced the other biopolymers we can blend, and we are blending the system with the other biopolymers also, and we are starting this work only now. Now we have started with the bacterial nanocellulose production only.
So far you have synthesized the bacterial nanocellulose effectively.
Yes,
And
yes,
you are
yes.
planning to incorporate dopamine and green
Yeah,
aerogel to the
other
material.
ingredients, yeah, other plant based ingredients also, which enhances the wound
So
healing.
that is your future plan. So far you haven't done anything on diabetic wound healing, right?
We just synthesized, yeah. We are synthesizing
Okay.
and
The
functionalizing the
title
nano.
seems to title was a little bit confusing. In the title, it was given as diabetic wound management. So far, you haven't done anything on diabetic wound management, or even cell culture studies. Also, you haven't done. You have synthesized
Yeah.
bacterial
No, no, no,
nanocellulose.
no. We are just starting only. Because the synthesis
Okay.
of nanocellulose we have to optimize, and
So,
functionalization we have to do a lot of work. Yeah, this is the first year of this project.
so you could successfully synthesize bacterial nanocellulose,
Yes,
right?
yes, yes, yes.
And what are the responses you are planning to synthesize an intelligent patch?
Yeah.
So, what are the stimuli you are focusing on? What are the types of stimuli you are focusing on?
Yeah, we are incorporating several ingredients. And Gladys, you can answer this question if you are planning
That
it.
I understood, madam. You are planning to incorporate dopamine, modified
Yeah,
dopamine, and green aerogels, right?
yeah.
Okay, and there should be a response. Intelligent patches means it should respond to some stimuli. So, which are the stimuli you are planning to focus on?
Ma'am, can I respond?
Yes,
Sure,
yes.
I'm
sure,
actually
sure, sure.
working on this. Ma'am, we
Yeah.
are actually looking forward for a pH responsiveness. So we
Okay,
are
pH
actually adding a
responsive.
component that can actually respond to the pH. So that's why we call it intelligence. So while we apply this particular patch on the wound, uh, these wound can actually test if the wound is healing or if it is getting infected based on the pH of the wound. We can
Okay.
have a
How
real-time
does the
transfer.
pH change in the case of a diabetic wound compared to a normal wound?
Yes.
Diabetic wound pH usually increases, ma'am, for a diabetic wound or any kind of infected wounds, pH usually increases. So when the patch is normally applied, if the wound is getting healed, it responds to the pH. And if the thing is getting infected, it responds in another way. Like we got a visual color shift as well.
You are expecting a
Real-time
color
monitoring
shift.
will be possible.
Yes, ma'am, color shift based on the pH.
Which component of your gel will your patch may be responsible for the change in color shift? I know that the diabetic wounds are highly alkaline. They are having an pH of 8 to 9. That is true. And which of your component may be leading to that color change in your patch? Which component can lead that?
Ma'am, that we are actually working on that. We haven't
Okay.
published or we haven't done anything with that. So I think maybe
Okay. And how are you planning to incorporate dopamine? Whether the oxidation can change the functionality of dopamine, or how are you planning to incorporate dopamine?
I think so, ma'am. According to the literatures that I've studied, like there are two kinds of cross-linking. So I'm trying to look forward for a one-pot method. It is there, some kind of hydrothermal autoclaving actually. So
So
with
whether
that,
the hydrothermal autoclaving will that may lead to the inactivation of dopamine,
no, ma'am, no,
biological activity may be lost by that autoclaving.
no, ma'am, no. It can withstand it.
It's you are expecting to withstand
Yeah,
the
ma'am.
biological activity.
Yeah, ma'am. In literatures, we've actually seen it to be okay with the diabetic healing actually to follow that.
No, it's not clear, Gladys. Can you explain it a little bit? You are
Ma'am,
trying to incorporate dopamine to the by bacterial nanocellulose by which method, and you will be doing autoclaving after incorporation or prior to incorporation?
ma'am, for incorporating the dopamine, we'll be using an autoclaving method. In order to incorporate dopamine, we'll use a particular kind of autoclaving method.
So there are reports on successful incorporation of dopamine by autoclaving.
Yeah, ma'am, yeah.
Okay.
Seen a few
And
papers. We have to work on that. They've did it with some other polymers. So now I have to take it on with bacterial cellulose.
and whether you are planning to do sterilization after creating this patch prior to
We sterilize this patch is already sterilized. Like after the purification and the neutralization thing and all, we'll give this one a prior autoclaving, and after that we'll go for the dopamine autoclaving. The patch is
so
already sterilized.
initially you are giving an autoclaving and then the dopamine autoclaving, and where comes the green aerogel?
So after this process, we'll go for a process called lyophilization. So that is
Okay,
what we are actually planning. We'll see
okay.
how the cell comes in.
A lyophilization I understood. When are you planning to incorporate that aerogel, green aerogel part?
Ma'am, actually, green aerogel is the material that we would get after all these process. That is the patch actually. It is an aerogel based patch.
Okay. I thought so something different from this title. This title was a little bit confusing. I thought you are incorporating an aerogel. So you are synthesizing the bacterial nanocellulose and you are incorporating dopamine, right?
Yeah, ma'am. And we'll modify it into an aerogel, which can be applied transdermally on the wound. And
Okay.
intelligent because we can have the real-time monitoring of the wound healing.
Okay, and you are planning to do the in vitro studies and followed by in vivo studies,
Yeah,
right?
ma'am.
Okay.
Yeah, yes.
So this is the first year of your project. Okay, advanced best
Yeah,
wishes to the whole team. This is an interesting work. This is an innovative work. All the best wishes to you.
okay, ma'am. Thank you so much. Thank you so much.
Okay, thank you. Can you introduce yourself, ma'am?
Yeah, I'm Dr. Mini, professor in the Department of Biochemistry, University of Kerala, Karivattam campus. We are also doing on these diabetic wound healing works, and we have synthesized an innovative hydrogel scaffold, which was found to be very effective in diabetic wound healing, for which we got a patent. My student Fatima Romaisa got an Indian
Okay.
patent. So that is why I'm interested in this diabetic work.
Okay. Thank you. Any other questions?
Okay, then if there are no other questions, can we conclude the session?
Yes, I think so. We can conclude.
Okay. So
Thank you.
thank you so much. Thank you so much, ma'am. And thank you so much for to all the participants for your time. So we'll wind up the session. Thank you.
Okay, thank you all for your kind attention. Thank you.
Thank you.
Thank you, Miss. Thank you.